Okay, I think we'll get going. So welcome everyone. Welcome to this webinar on the JSNA looking at children known to the Youth Justice Service. So just by way of introduction, my name is Will Leather. I'm a Public Health and Commissioning Manager at Notts County Council. And presenting today is Nick Suttonwood, who's a Youth Justice Development Manager at the County Council. And we're also joined by John Evans, who's a Youth Justice Service Manager at the County Council and will help answering questions. So in terms of the purpose today, so it's about summarising the findings in the JSNA on children known to the Youth Justice Service, and really to provide an opportunity for you all to ask questions and share your own reflections. And then think about how you can use the findings and recommendations to improve outcomes through your own work, your team or your organisation. So in terms of the rundown of today, so Nick will spend about half an hour or so summarising the JSNA. And during that time, please do use the chat to ask questions or share your own thoughts or reflections. We really welcome the different perspectives that you can all bring to this discussion, but please do bear in mind this isn't the place to discuss individual cases or share confidential information. And then in the last 20 minutes or so, Nick and John will be responding to your comments and your questions. Just a couple of bits of housekeeping. So this webinar is being recorded and published online so that it can act as a resource that anyone can access as part of the JSNA. So for that reason, cameras and microphones have been switched off for this first part of the presentation. But as I say, please do use the chat. We want to answer your questions and hear your reflections. So before I hand over to Nick, just very quickly for those of you who would benefit from a bit of context about what the JSNA is about. So it's an assessment of the current and future health and social care needs of people in Nottinghamshire, and it summarises the evidence of what works to address those needs. We're constantly updating the JSNA. This is one of many topics that are covered. So we have topics looking at mental health, carers, substance use, just to name a few. So it covers a whole range of issues and topics. The benefits of the JSNA are that it highlights inequalities and the actions that are required to reduce them, helps facilitate partnership working by combining different professional and community perspectives. It helps identify and share information about our local community assets, and it helps commissioners, service managers, other decision makers to identify priorities for action based on the balance of different needs. So the JSNA takes different forms, but it's all published online through Nottinghamshire Insight. And just to be clear, there is a separate JSNA for the city. So sometimes we work collaboratively, we work and produce work that sits across the city and the county, but for the purposes of today, this is just related to the county. And then finally to say this webinar, it's a trial. So we're aiming to make the information that we produce more accessible and reach a wider audience. So it's great to see so many of you here today. But on that note, we're really grateful to get your feedback at the end, and I will put a link to a form that'd be great to have your input on. So that's it from me. Nick, I'll hand over to you.
Thanks, Will. Welcome, everybody. It's nice to see so many different people from different agencies here today, so that's really exciting. As Will says, this is a bit of a trial in terms of presenting the findings from the JSNAs that we're doing. And I think for us in Youth Justice, we welcome this opportunity to reach sort of the wider partners and talk about our young people in Nottinghamshire and their health and wellbeing needs. I suppose where we start is the reason for doing the JSNA this time was we haven't had one for 10 years. And as we know, things move on and the service has changed a lot in that time. We work in very different ways. You know, most significantly, I suppose, when we did a JSNA 10 years ago, we were talking about young offenders. We don't talk about young offenders anymore. You know, we're more of strengths-based. It's children, and it's children that's the heart of what we do. So how we're going to structure this today is, as Will says, we're going to talk about the health inequalities of children that are known to youth justice more generally. I'm going to then move on to say who are our children and tell you a little bit about the children that are working with us in Nottinghamshire Youth Justice Service. And as Will points out, we're talking about county young people here. Then I'm going to move on, what are the health and wellbeing needs of these children? And then for us to have a think about how we can work and meet the health and wellbeing outcomes for our children, how we can improve the outcomes for them in their life now and also in the future. So thinking about children who offend more generally. So we know that children who offend, they're considered a marginalised group who experience complex health needs, and it's greater than those that are in the wider non-offending population. And we know that they're known to experiencing poor health outcomes in comparison to children who don't offend. In terms of neurodiversity, compared to 1 in 6 in the general population, children who are known to the Youth Justice Service, it's 1 in 3 are known to have a neurodiversity need. Speech and language communication needs is thought to be quite high for children in the Youth Justice Service, and it's said to be 60% of children in the Youth Justice Service have an unrecognised speech, language and communication need. 80% of children in England who have been cautioned or sentenced for an offence are thought to have a special educational need. And also the prevalence of social, emotional and mental health needs is thought to be 3 times higher for children who offend than those in the general population. Children in care are overrepresented generally in the Youth Justice Service, and also in terms of school exclusions, the proportion who have been cautioned or sentenced for an offence is thought to be 72% suspended, and 10% of those have been permanently excluded from school. So we know that there's disproportionality in that area. And we know that despite high levels of physical and mental health amongst our children who offend, that cohort are more likely to have high use of secondary healthcare but low usage of primary healthcare. So let's talk about our youth justice then, our children. For those that, I suppose, a little bit of a snapshot in terms of youth justice and what youth justice is, I've sort of realised lately that actually some people aren't aware of what youth justice is. So our Youth Justice Service in Nottinghamshire, we work with children aged 10 to 18-year-olds, and those children who have been committing an offence and they come through statutory routes, or the people who are at risk of offending. We're a multi-agency team, so we've got case managers from various disciplines, but also we have a lot of seconded staff in from the police, probation, health, education and social care. So they're sort of the makeup of our service. Some key definitions that we're going to talk about today, and so I'll put them in front of us so we can have a little bit of a think and maybe challenge some perceptions that are out there. First time entrants. We're going to talk a lot about first time entrants today. Now, these are individuals who've committed an offence and they've been given a formal caution or conviction which places them into the criminal justice system for the first time. And I just wanted to sort of put it out there. And so in terms of this, in 2017, there were 322 first-time entrants into Nottinghamshire Youth Justice Service. How many first-time entrants do people think there were in 2023? Now, feel free to put it in the chat, to just make a note of this, because we'll come on to the answers later. I'll just give you a few seconds to think about that. Now, Will's been really kind here because he told me to give you options and I was just leaving it open. I was like, let them guess. He says, no, we need to give them options. Right. So preventative interventions. We talk a lot about preventative interventions today. In Nottinghamshire, our prevention programme is called My Futures. Now, this is voluntary programmes of interventions that are offered to children whose behaviour is placing them at risk of coming into contact with the police. This is a big part of our work. In relation to that, I want to know, I'm interested, what percentage increase have we seen in our prevention interventions being delivered by the Youth Justice Service over the last 3 years? So again, you've got 3 options. And I suppose this is just to say, we know that a lot of services offer preventative interventions, but this is just focusing on us within youth justice. Interesting. Right, in terms of diversionary interventions then, where a child has offended, diversionary outcomes, these provide an opportunity for children to engage with us on a voluntary basis, and this is outside of the criminal justice system, and they don't receive a criminal record. So what percentage increase do you think there's been in the amount of diversionary interventions delivered by Youth Justice Service, again in the last 3 years? So they're the 3 areas that we're going to focus on today. I suppose it's of note to say that we're not going to focus on children who've been sentenced to custody. We're mainly going to be looking at first-time entrants, prevention, and children who've accessed diversionary outcomes. So let's see if there's any surprises. So children entering the Youth Justice Service in Nottinghamshire has been fairly stable over the last few years, but actually it's a third of what it was 7 years ago. So we're now in 2023, there was 109 first-time entrants in Nottinghamshire compared to 300 and what was it, 309 7 years ago. There's been a 183% increase in the number of children engaging in preventative interventions, which is a huge increase. And as you can see from that graph, you know, we dipped during COVID, but then it's just increased year on year. And there's been a 65% increase in the numbers of children engaging in diversionary interventions that have been received as part of our out-of-court disposal process. So again, this is, you know, it's increased. There's been a bigger focus on diversion. A smaller number of children are being processed through formal criminal justice processes. And we're seeing fewer children come through the courts and accessing statutory interventions, which is what we want. It's more child first. We want to be able to divert them. We want to reduce the stigma that is associated with coming into the criminal justice system. And we want to meet more children's needs on a preventative basis. Just out of interest, and I said we're not going to be touching on children who have been given a custodial sentence, but just in the chat, how many children do you think were sentenced to custody in Nottinghamshire in 2023? Just throw some numbers. What would you think? Does anybody want to guess? 60. Higher or lower on Richard? 60, 80, yeah. So we're talking about county children here then. So in Nottinghamshire in 2023, there was no children sentenced to custody. So interesting, you know, how high the numbers were. It is, and surprising, I think, for a lot of agencies. So who are our children in Nottinghamshire then? So this is what we know about our children in Nottinghamshire Youth Justice Service. So the majority of children that we work with in Nottinghamshire Youth Justice is boys. 76% boys, 24% girls, and this is across the board. The majority of our children are white, and why the majority of children are white, they're actually underrepresented within the Youth Justice Service, and children from an ethnic minority background are overrepresented. Now at the bottom you can see the ages of the children that are known to Youth Justice Service across all the different interventions, and what it tells us is that the age of children accessing prevention and diversion peaks at the age of 14. And what this means is that actually we're keeping children out of the Youth Justice Service longer. And so you can see a first-time entrance average age and the children who are accessing court is an 8-year-old age. So we are managing to keep them out of the criminal justice system for a lot longer. The majority of children who access interventions, and this is across the whole range, prevention, diversion, statutory outcomes, the majority of those children are coming from the Mansfield and Ashfield area. And this corresponds with high levels of deprivation. And I think that's the same, as I say, across the board. Referrals for prevention, majority from Mansfield and Ashfield, diversion, and our first time entrance rates. So a busy area. In terms of the most common offence for children who are entering the Youth Justice Service, within Nottinghamshire, it's violence and weapons possession. Now, this is in line with what's happening nationally. And this is the same for children who are accessing diversion and preventative interventions. The majority of those children are committing violent acts. Our second most common offence is motoring. So that's for our first time entrants. And I suppose what I should have said at the beginning was what I'll try and do as I'll work through this JSNA is talk about some of the work that we've been doing since the JSNA has been written. So we've not stood stagnant and waited for it to be written. We've actually took some actions. If I put that into perspective, there was 20 first-time entrants for motoring in 2023. And what we worked out was that actually, when we talk about motoring, this was a low-level one. So we're talking about, mopeds, just sort of low-level motoring offences. Now, what we've done is we've done some work with the CPS and the police and the courts and looked at actually how can we support these young people who are coming through the courts. The majority of them are getting points and a fine. But what it rendered them was a first-time entrance in the criminal justice system. So we've been working with the courts in that time to divert these children away from the courts and so that they can access a diversionary intervention, because that's something key as well to highlight. These children weren't getting any intervention to help them not to reoffend, and that's one of the most important things that we wanted them to access. And so in that time, we've been diverting children from the courts so they're not then becoming a first-time entrance on account of motoring offence. So we've been doing some really good work there. So a focus on gender then for our children in the Youth Justice Service. As I said, the majority of children who come through the Youth Justice Service are male. Now, as you can see here, our prevention and first-time entrants are more or less in line with each other, 15%, 14.6%. Now, this is in line with the proportion of girls who are offending, but actually there's a larger proportion of girls who are being diverted into our out-of-court disposals. Now, we've looked at this and we've a few questions come to mind is why aren't these girls coming into preventative services? Why is the majority of the girls who come through diversion are people that we've not had any contact with before? It's the first offence, they're being put into out-of-court disposal panels, and this is leading us to question actually why. What is it that's happening? Is it that girls are being treated more harshly than boys? Generally, what we find is that if boys are getting into fights, if they're getting into trouble, then actually that's picked up on and they're diverted into preventative services and referred in for us to do some work. But what we're finding is that girls' needs are very different and more complex. And actually, the first time that we're hearing about them is when they've committed an offence and they're being referred into diversionary services. The other thing that we've done on the back of this is actually to take a cohort of girls and have a look at their needs. And what we're finding is actually the needs of girls who are coming into our service is more complex and is very different to boys. Whilst the majority of the offences that they're committing are violence, actually they're linked to emotional issues, their relationship, it's about their peer group. And what we're identifying is it's those needs that are being missed at an early stage and they're not being referred into the right services and getting their needs met. And so the first time that it becomes an issue is when they're referred into us when they've committed an offence. So what I'd like to do is present a case study. Now, this is just sort of reflective and representative of one child and one girl's young experience coming into the youth justice system. So she reported that she'd fallen out with someone who had asked her on Snapchat to meet for a fight, and which she did, and she took some friends along. She says, things got out of hand, it made me mad, and I got done for an assault, which was filmed on the phone and uploaded to Snapchat. So she talked about her experience before she came into us at Youth Justice. And what she was telling us was that her parents broke up, this messed her up. She said that she struggled with her mental health and she was self-harming by cutting herself. Her mum and dad thought that she had ASD or ADHD, but she was on a waiting list for assessment for ages. And she also spoke about her educational experience, telling us that she was being bullied and she was missing school. And as a result of the offence, that she was now permanently excluded from school and currently being homeschooled. And I think this just highlights actually the complex needs of children, and especially females who are coming into the Youth Justice Service, and sort of highlights for us actually what are the needs, and we need to be getting better at identifying those needs at an earlier stage and ensuring that those needs are met. So moving on then. So social, emotional and mental health needs, this is the most prevalent area of need across all areas of intervention. So as you can see, this is identified by case managers who are working with these children across the different preventative, diversion and statutory orders. And it can be as high as 92% of children who are accessing youth cautions and youth conditional cautions. What we found was now that there's also a disparity in services. So within youth justice, what we were finding was that children who were accessing statutory orders, actually we could be referring into head-to-head for them to have their needs assessed and met. But actually children who were accessing diversionary and voluntary programmes of intervention were not able to access those services. So on the back of this JSNA, it's been recommendation that actually it doesn't matter where the child is within the Youth Justice Service, but what we want to ensure is that they've got equal access to services and they're able to have their needs met. And there's now been further resources put in, so hopefully in the future this will be the case. Another thing, school exclusion. So as we know, school is a big protective factor for our children. Now, what this graph indicates is the percentage of children who have experienced a school exclusion over the last 3 years. Prevention, 76% of children accessing preventative interventions had experienced a school exclusion. Diversion, nearly 70%, and again with first-time entrants. So what does this tell us then? So we know school exclusions are going up, not only within Nottinghamshire, but obviously for our children within the Youth Justice Service. And what this tells us is that we need to get better at identifying the needs of children who are at risk of being excluded from school. And it also tells us that actually we need to get better at working with the children to identify, you know, what is it that's happening within school, what that actually might impact on you in the future. So another high area of high need, speech, language and communication needs. So we had a speech and language therapist that was working with youth justice for a time, and she did case sampling carried out with the children that were in youth justice. And what she identified was that 82% of those children that were working with the Youth Justice Service had a speech, language, communication need that had not previously been identified or addressed. Now, national data indicates that they would expect about 60% of children accessing youth justice to have a speech, language, communication need, whereas what we were picking up was actually it was a lot higher within Nottinghamshire children. What we were finding was that whilst these children were being referred to services such as CAMS and head-to-head, it wasn't for the speech, language, communication needs. Case managers were picking up on other needs and identifying it as an ADHD, a neurodiversity need, but it was actually the speech and language need that was being missed. And that can have huge implications for our children in the way that we work with the children, in them understanding and remembering information, in how we talk to them, you know, how we're interpreting what they're telling us. Another area of need, special educational needs. Now, our reporting from youth justice systems tells us that 37% of the children that are accessing preventative interventions had a special educational needs. Now, this can range, the way that our reporting is set up, this could be anything from neurodiversity, dyslexia, a disability. Now, what we've identified is that actually there's a potential underreporting here, because when we've done audits and other case sampling exercises, we know that actually the needs of our children, there's a lot higher proportion of children who have a special educational need. And so on the back of this findings that we're looking at more educating staff on identifying those needs, but also it's about the partnership working as a whole and identifying those needs within children and making sure that they're getting the right support at the right time and being referred into the right services. So substance use. This is another area that we've identified that there's potential underreporting. So of 108 children that were closed to youth justice in one quarter, 37% of these were identified as having a substance misuse need. We've said, this is consistently, we're coming out between 30 and 40% every reporting period. And whilst I said, there's an underreporting need, this is not within youth justice alone. Another JSNA that was done on substance misuse needs identified that actually there's an underreporting across the board. And so what we want to do is get better at actually identifying those needs in our children and making sure, again, that they're getting their needs, they're recognised and getting them met. Children known to social care. So there's high rates of children being involved with children's social care, having contact with early help services prior to them coming into youth justice service, yet they're coming in and they've still got unmet needs. And what this is suggesting to us that we need to identify and address the needs at an earlier stage. Is the mantra within Nottinghamshire, we need to identify, make sure that they're getting the right needs, the right support at the right time. And also what we need to do is get better at working with early help services and making sure that they're getting their needs met across the board and by the partnership. So in terms of recommendations then, even though we're rich in data and there are some gaps, and we've made recommendations to try and embed processes for recording and reporting. I don't know whether you picked up as we went through, our reporting on children who are accessing preventative interventions isn't as good as what it should be. And so we're improving that within the service. We've made some recommendations regarding knowledge. We need to improve the partnership's understanding of attendance data in relation to schools. And we also need to increase our staff's understanding of special educational needs, the code of practice, graduated response, so we can identify needs and make sure that those children are getting the right help at the right time. What we also want to do is we want to work on our identification and diversion of girls who offend, and also from children from Black and minority ethnic backgrounds, because these are, again, children that are not referred into preventative services. I've already spoke about the diversionary alternatives for motoring offences and first-time entrants. And then also another recommendation was increasing the resources. We want to strengthen access to speech and language resource within youth justice and increase access to emotional and mental health provision for our children that are working with the service. We're also looking at the support that's provided to children who are educated other than at school, and finding out what support's in place and whether that's the right support and what else we can do to improve the children's needs. And any questions, that's a whistle-stop tour.
Thanks, Nick. Great presentation. And yeah, like you say, that is a real whistle-stop tour. So Nick's done a huge amount of work last year to produce the JSNA. And if you want to know more, there's lots more to find out on the full report, and I will send out the link to that so that you can access it after this webinar. But yeah, so it's over to you really. So Nick and John are here to answer your questions. If you have a question, it would be great to hear it. There are no stupid questions. If you've got a question, it's likely someone else is thinking the same. And also, if you've got a reflection that you want to feed in, I know we've got a whole range of colleagues that are representing different organisations here today, and so it'd be great to hear. Are you seeing these sorts of things in your day-to-day work as well? What other challenges are young people facing in relation to criminal justice? It'd be great to kind of start that conversation. But yeah, as I say, please don't start sharing and talking about individual cases. By all means, talk about examples, but try and keep it high level. So you can use the chat if you want, or I'll give the option to use your microphone. I'll give the option to unmute. So yeah, so over to you.
I suppose it's any surprises anywhere. Was there anything anybody picked up on that they thought, actually, I wouldn't have thought that, or anything that was that stood out?
Natalie, do you want to come in?
Hi, yeah. I suppose I just wanted to to congratulate you really, as someone who worked in youth justice for many, many years in the city, to hear that there were no young people that went to custody in a year is almost mind-blowing to me, given given the what I saw in the years that I was working. So yeah, just a big congratulations around that, really.
Cheers, Natalie. And I think it's, you know, it's fair to say when I first came into youth justice probably 10 years ago, it's tipped the balance. We was working with probably 80% statutory, 20% preventative and voluntary, and it's really it's flipped on its head now. So the majority of children that we do work with within youth justice now is our preventative children, and it just goes to show it's working, getting in there early. John, did you want to say anything? Because I picked up on the girls thing, but actually, I suppose wider, we've not just stood still with the girls. This is something that we've been looking into further. We've done more audits on the girls and been looking at actually, you know, where does this fit into our other streams of work? What more can we do? And I know you're linking in with the violence. Is it the Violence Reduction Partnership you're linking in with?
Yeah. So there's actually a really big piece of work being commissioned by the Police Crime Commissioner's office at the moment, which I won't be able to do justice here, but there's a lead on that piece of work, who's got a plan across girls, a very sort of girl specific plan and a women specific plan, and she's working kind of all kind of agencies on that. So something that we're working on is kind of trying to progress the issue that we have with girls coming in at the earliest stage. It's reassuring that we're not seeing an overrepresentation later on in the system, but still too many come into our sort of more formalised diversionary processes. And it's probably not that much of a surprise, because the things that bring boys to attention at an early stage aren't the things that bring girls to attention. And girls will kind of mask and deal with their inner turmoils and issues in very different ways to boys. So we're looking at, you know, things like officers in the case, police officers, being more attuned to the needs of girls and referring girls in to preventative pathways in an early stage. For example, if they at the point where they might issue a community resolution, if they deal with a girl who might be shoplifting or committing some other offence, or that, getting them more attuned to how those needs might present or manifest in girls compared to boys. There's a whole host of things that Rosie, the Police Crime Commissioner lead, is working on. So I think that kind of gives a flavour pick on that.
Cheryl's asked, in respect of early help, I'm assuming you're linked in with the family hubs, which are multi-agency, multidisciplinary spaces. Within Nottinghamshire Youth Justice, we're going through a little bit of a transformation. So come the 1st of April, that we're also changing sort of how we're structured in terms of putting more of an emphasis on the preventative and building more links in with the community. And so I think that's from, you know, when everybody moves into the different teams and the early help and the family hubs and youth justice know what areas they're working in, then this will be something that we work on from.
Richard, you've got your hand up. Do you want to come in?
Yes, I'm from Health Watch, so our perspective is health and care needs. That point that was made about that the young people that you're working with are often missed out on primary healthcare, but are picked up by secondary healthcare. Do we have an idea of why that's happening? In other words, why is primary care young people services not catching these young people, identifying their needs? Because it's very obvious that these needs then lead to far bigger problems later on.
I suppose it's just getting their needs met, isn't it? It's their groups that they come from. We have a specialist youth justice nurse who works with us in youth justice, and such things as, you know, her biggest she screens all of our children who are coming in for statutory service, and the biggest thing that she was picking up on was children missing out on vaccinations. So they're coming into our services, and something as simple as that they've missed out on the vaccinations. Maybe families haven't pursued them. If they're missing out on checks within the schools, if they're maybe not attending school, then it's not being picked up there. But I suppose the bigger thing is that I don't know. It's just what we found out, that they're just not accessing those services.
It does feel like that's a conversation that healthcare needs to have, probably alongside education, in terms of the why are we letting people fall through.
Yeah, and we do a lot of work, Richard, in terms of trying to get people, registered with dentists, getting them eye tests, getting them registered with a GP. We try and do a lot of work there to try and sort of fill those needs. But often, even whether we've got the youth justice nurse and we've got access to that, a lot of young people will say, I don't need it. If I need anything, I'll turn up at emergency care.
Yeah, thank you. I appreciate that.
I was just going to add there, Nick, that because we've got the overrepresentation of children who are known and open to social care and other sort of tier 3 services. We've got the overrepresentation in terms of exclusion from school. And between those two camps, that's where a lot of these things like vaccinations and healthcare, primary healthcare needs are being missed. And we'd expect to see that, I think, with our larger sort of social care sort of cohort as well.
Yeah, and that was definitely, we had a webinar looking at children in care and care leavers last week, and that was definitely a theme that was coming through as well, in terms of that gap between primary and other forms of emergency healthcare. Moira, do you want to come in?
Hello. I just wanted to ask about My Futures is our main vehicle for prevention work, isn't it? Yeah. Where do the referrals come from for that? What's the proportion looking like for whether they come directly from school, from social care, from health, etc.?
I suppose we just answered that, haven't you? We get a lot of referrals from social care, family service, education, police. I suppose, don't know whether what's the highest referral, John?
We do have these notes, but we don't have them to hand. Nick's referenced the main ones, but I don't know what order and what proportions they come in on.
Yeah, because I'm thinking about that idea that the girls aren't coming in early enough and aren't coming in through the prevention route, and whether there's something there around communication to the right settings. So if we've got young people in schools, of course that's my thing, if we've got young people in schools that should be being referred and they've been missed, whether there's a piece of comms work there is what I'm really getting at, whether they're coming in too late because they're coming in from social care mainly or other referrers, and they're not coming in early enough from universal services that are involved with kids.
Yeah, I think what it is, Moira, as well, is that the children, girls being met, but they're being missed, and we're looking at our thresholds and also to widen that out. But sometimes we don't want them in. We don't necessarily want them into youth justice preventative services. We want to make sure that their early needs are met, don't we? And that's and that's what we're trying to do at the minute, is sort of do a little bit more communication, raising awareness within an educational setting as well about what we're finding, because we have done some audits internally and said, where were the missed opportunities for these girls, and a lot of it was around school attendance, school exclusion, mental emotional health needs were being missed, and so therefore they weren't getting the help to support them, so that would have potentially prevented them from coming down the diversion route. But you're very you're spot on in what you're saying, and we've got I think 3 events coming up in the next few months where we're making links more with the schools, with secondary schools, and trying to sort of get those messages out there to get people to be a little bit more alert when they're working with females about what their needs are and where they can get their needs best met.
Yeah, sounds like it's something that might come together a little bit with the family hub stuff, early help advisors, all of that. We're asking people sometimes without a lot of experience in some areas to pick the right service at the right time, how we make sure they do and how we get the communication to both the people that make given advice on that, like myself really, as well as the schools and youth centres or whatever as well, is a bit of a there's a bit of a trick there, isn't there? I don't know how you solve it, but I'm sure we're all here to help if we can with that one. Yeah, let us know.
Cheers, Moira.
Shall I just come in on that bit while there's just a bit of a pause, and that more just to reassure, as part of the transformation work that we're doing. I mean, I've sat down with the managers this morning, and we're kind of mapping out how we reach into the different kind of localities and partnerships. And we're talking about the DSL network this morning and the communication to go out to them. And we've got managers who identify sort of theme leads, agency leads for each area. So that was something we specifically discussed. Yeah, and as Nick says, we're not always the right first port of call. However, what I will say is that there isn't always a plethora of options, and it's a different set of options across the county, and it can be a changing picture, but at least we have the benefit of being a consistent. And when we get, but if we do get girls or even boys in who we don't feel appropriate for our service, we have what's called a youth support group, which is a group of professionals that will look at it, including youth service, early help unit, and talk about what is the right place for this child. So we won't just ignore a referral, we won't just knock it back. We'll always look to do the right thing by the child to get a good outcome and to get some kind of signposting or effective onward referral pathway.
It's also complex, isn't it? And I think that hopefully things might get a little bit easier in the long term. We'll see. You always hope, don't you? But actually, yeah, as long as you're getting the right children at the right time, let's not worry about it. But if there's more we can be doing, just let us know.
Yeah.
Nick, did you give the answer to you asked about first time entering numbers and all that? Did you actually give the answers to your multiple choice? Did I miss that?
Yes, I did. Yeah, first time
right,
entrant.
sorry.
Yeah, 2023 there was 109. Yeah.
All right, okay.
You missed my second slide.
That's okay. Sorry about that.
I think we're about done. Are we, Will?
Yeah, I'm just there's a comment in the chat from Helen, who is interested about support and working together across district councils, which I suppose is really important because districts are involved in things like housing, like leisure services, which are obviously really important in terms of health and well-being of for young people and that preventative offer. So I don't know if you want to talk any more about not necessarily districts, but kind of broadly partnership working to kind of get input from a range, because it's youth justice can't provide and meet all the needs of young people. So it's sort of how does the partnership work together to address that?
I could talk a little bit on that if you like, Nick. Right, so I mean it's a very good point and one that we definitely need to get into more. And we know there's a bit of a changing kind of district county council landscape ahead, or certainly potential changes. But we have a chief exec from Borough Council on the board, our Youth Justice Partnership Board, very, very cool member of the board. I was invited to the chief exec for the district council's chief execs meeting. She did a presentation on Child First, tenets and how these need to filter throughout the districts as well. And the real key focus is on community safety, community safety teams, but also much beyond that as well. And sort of priming and prepping district work is to kind of really spot our children, the needs of children at that earliest stage, so that we can get in there as soon as possible and be as diversionary as possible. Definitely open up to new to meeting outside of this. The new youth justice model is very much set up to have 3 strong locality teams focused on prevention and diversion, and the partnerships as their priority, which is a total flip from where we were, say, 10 years ago, where we're largely reactive statutory agency waiting for the referrals to come in. We're much more proactive, almost outreach to our approach in some ways now.
And Zoe's put a message in the chat regarding access, children accessing primary and secondary healthcare. It's really helpful, Zoe.
Thanks, Zoe.
Yeah, I mean, that's a really interesting comment, and it came up as a theme in the children in care and care leavers discussion last week. I think the issue with services not always being able to flex to to account for young people and those that are vulnerable. Just things like being able to get up for 8 a.m. to get an appointment with a GP. Yeah, just simple things like that, which that can make accessing services quite difficult. So yeah, really interesting comment. Richard.
I will add, actually, Healthwatch did a little bit of work. It's a while back now around actually the experiences of young people interacting with the healthcare system, but I suspect it will be exactly the same for many other services. And we identified a number of issues that young people face in terms of actually being proactive. And obviously one, and it's come up in the news already this year, about young people being uncomfortable just answering the telephone. One of the corollaries of that is they will answer the phone if you say, I'm going to phone you at 8:20, and you phone at 8:20. If you phone at 8:15 or you phone at 8:30, they aren't going to answer you. That's how much they are concerned, scared by random phone calls. So I think there is an element here of services have got, you make a commitment, you must live up to it. Otherwise, you will find that the young people won't engage with you. And yeah, for those who are excluded, at least school hours mean something slightly different. But for those who are not yet excluded, it is amazing how many services don't seem to take into account that children are at school and can't just attend or speak at random times that suit a service. So I think it's just practicalities have got to be taken into account. Thanks.
Some interesting points there, Richard. Yeah.
So we're almost out of time, but I think we've already had lots of interesting questions and discussion. Does anyone want to throw in a last question or comment before we close? No, I don't think so. Nick and John, you're off the hook. So thank you everyone for taking the time to join us today, and thanks to Nick and John for presenting and answering questions. Like I say, this is a trial, so it'd be great to get your feedback on how this has gone today, what we can do to improve. And I'll just put that in the chat. Should only take you about a couple of minutes to complete. But yeah, thanks everyone, and we'll close it there.
Thank you.
So, ciao.